Welcome, everyone, to ERMP and Beyond, where the heartbeat of clinical medicine resonates with every case we explore. We invite you to embark on a journey through the intricate world of medical puzzles. Together, we'll dissect, analyze, and solve the enigma that awaits us. Prepare to be challenged, enlightened, and inspired as we delve into the essence of today's medical marvel. Let's begin our quest for knowledge and understanding without further ado. A 34-year-old female patient presented with recurrent abdominal pain of 3 months. The pain is often exacerbated by eating or emotional stress and relieved by passage of flatus or stool. Otherwise, no blood, mixed stool, fever, and weight loss. Stool examination is non-revealing. What is most likely diagnosis in this patient? A. Crohn's disease. B. Ulcerative colitis. C. Irritable bowel syndrome. D. Celiac disease. Hello and welcome to today's session. I'm thrilled to have you all here as we delve into a topic that often causes confusion: the differences between irritable bowel syndrome and inflammatory bowel disease. These two conditions affect the gastrointestinal tract, but they are distinct in their symptoms and management. Let's start with irritable bowel syndrome. Imagine, if you will, that on the left side of our visual guide, we have the symptoms of irritable bowel syndrome laid out. Many of us might be familiar with bloating, a sensation of fullness or swelling in the abdomen. It's uncomfortable, isn't it? Then there's abdominal pain, a symptom that can sneak up on us, often related to our meals or the stress we encounter in our daily lives. Now, shift your attention to the right side, where we outline the symptoms of inflammatory bowel disease. Here, the signs are more severe, pointing towards an inflammatory condition. Bloody stool, for instance, is a red flag, quite literally, indicating that there's inflammation in the digestive tract. Fatigue is another symptom, a type of exhaustion that lingers despite rest. Some individuals with inflammatory bowel disease also experience unintended weight loss and a decrease in appetite, which can be concerning. But here's where it gets tricky. Right in the center, we have symptoms that overlap between irritable bowel syndrome and inflammatory bowel disease. Abdominal pain makes a reappearance, as do changes in bowel movements, which could mean diarrhea, constipation, or sometimes both. This common ground between the two conditions can make diagnosis challenging. Now let's see a bit deeper into the symptoms of our patient. She has been experiencing abdominal pain for the last 3 months, intensifying after she eats or when she's feeling particularly stressed. Interestingly enough, the discomfort seems to subside when she passes gas or has a bowel movement. She hasn't noticed any blood in her stool, hasn't had fevers, and her weight has remained stable. When her stool was examined, it didn't reveal anything out of the ordinary. So, what could be the most likely diagnosis for her condition? The patient's symptoms suggest a functional gastrointestinal disorder, as there is a pattern of pain exacerbated by eating or emotional stress and relief upon the passage of flatus or stool. The absence of blood in the stool, fever, and weight loss, along with a non-revealing stool examination, further supports this. Option A, Crohn's disease, is less likely because it typically presents with symptoms such as weight loss, fever, and bloody stools, which are not reported in this case. Crohn's disease is an inflammatory bowel disease that can affect any part of the gastrointestinal tract and often leads to complications like strictures or fistulas. Option B, ulcerative colitis, another form of inflammatory bowel disease, also presents with bloody diarrhea, fever, and weight loss, which are not seen in this patient. Ulcerative colitis is characterized by continuous inflammation of the colon, leading to ulcers and bleeding. Option C, irritable bowel syndrome, is the most likely diagnosis. IBS is a common functional disorder characterized by abdominal pain associated with altered bowel habits, without the presence of any organic cause. The symptoms described by the patient, such as pain related to eating and emotional stress, and relief with the passage of flatus or stool, are typical of irritable bowel syndrome. Option D, celiac disease, is a chronic autoimmune disorder where ingestion of gluten leads to damage in the small intestine. It can cause symptoms like diarrhea, bloating, and abdominal pain, but it is also associated with signs of malabsorption such as weight loss, which is not present in this case. In conclusion, after careful consideration of the patient's clinical features, irritable bowel syndrome emerges as the most probable diagnosis. This is supported by the patient's recurring abdominal pain that worsens with meals or stress and eases with the passing of gas or stool. Additionally, the lack of severe symptoms such as bloody stools, fever, and weight loss points us towards irritable bowel syndrome. As we conclude today's topic, I want to express my heartfelt gratitude for your participation. Discussing irritable bowel syndrome has been an enlightening experience, and I hope it has been equally informative for you. Your engagement is crucial, so please, subscribe to stay updated on future sessions. Your likes and comments not only enrich our case discussions, but also help us reach a broader audience through the YouTube algorithm. Thank you once again for your active involvement in today's journey of knowledge.